Good morning. Today is Saturday, 9:30 a.m. Eastern Time. This is our regular Saturday morning yoga therapy class. Today's discussion is very important and very interesting. This is for all of you now, especially the healthcare providers, yoga therapy teachers, yoga therapy practitioners, and for the people who understands the concept of health, the wellness, in contrast to disease and illness. Today's topic is called the art and science of yoga therapy. So what does it mean? Yoga, as you know, it's an anglicized version of the original Sanskrit word called yoga, which means union of our body, mind, and a spirit. It's a philosophy. The philosophy is called Yoga Sutra. Sutra are the aphorisms, small aphorisms written in Sanskrit, 196 aphorisms, of which 193 are to control your mind. It has been in Indian subcontinent for thousands and thousands of years. It used to be a oral tradition passed from teacher to the students. The person who wrote this philosophy, his name is Patanjali. So it's called Yoga Sutra of Patanjali. And the practice is an 8-limb practice, a step-by-step practice towards union and balance of your body, mind and spirit. Yam, social restraint, 5 of them. Niyam, personal restraint, 5 of them. Asanas, alignment, external and internal alignment. And we'll talk about it. It's a shape, it's a flexibility, it's a strength, it's a balance, all in your physical body. Pranayama, prana, yam. Prana is a life force, yam is a control and restraint. Life force for your breathing, voluntary control of your breath. 5th one is pratyahara. Pratyahara is a reject, ahara is an intake. intake through our five senses, controlling our five senses. Sixth limb is dharan, is the focus of your mind, and then slowly and slowly the focus goes away, defocuses, you are in a state of calm in the middle of crisis. There's a seventh limb, is called your dhyan or meditation. So meditation is the seventh limb of yoga. Finally, it's called samadhi, which is the union of your body, mind and spirit. Yoga therapy is the adaptation of the practices based on our patients' or clients' clinical condition. And that is the most important part of therapy as yoga. Now, most important concept of yoga therapy is believing in the philosophy of our father of modern medicine, who is called the Hippocrates. We as a Western trained physician, we take the oath called Hippocratic oath. Hippocrates said, even 200 BC, think about it, over 2000 years back, Hippocrates says, I am not interested about the disease a person has. I'm interested about the person who has the disease. Wonderful, wonderful statement. Another statement is that every disease is curable when you awaken the doctor within you. Introspection, looking inside you. And that is the art. Art is beyond science. Art is a philosophy. So let's talk about what we are discussing today. We'll discuss a little bit, then I'll show you the practices. All the practices and how to do them. And what you need to do, you need to incorporate these practices in your daily practice of 1 hour, 25 minutes of asanas, 25 minutes of pranayama, and 10 minutes of meditation. So, the first observation is that Western medicine, remember my book is called Yoga Therapy, Ayurveda and Western Medicine. You all have seen it multiple times, but I want to show you every time I have a class. It's called Yoga Therapy, Ayurveda and Western Medicine. Then it's called a healthy convergence. Western medicine is a reductionist. There is a multiple specialist. I go to see my pulmonary specialist, my lung specialist, takes care of me, gives me some medication or gives me some therapy. Go to see my cardiologist, my heart specialist. He really doesn't even know what the lung specialist has done and gives me some other medication or other prescription. I go to my kidney specialist, nephrologist, same thing happens. So who is the gatekeeper? The gatekeeper is your primary care physician. Primary care physician wants to put everything together, and primary care physician looks at you as a whole person. Primary care is not a reductionist. Primary care is holistic. Primary care is looking at you, doing your physical exam. So for example, say for any yoga practice, we also have our called reductionist holism. Reductionist holism means I have yoga practices as a reductionist. I have the practice of diabetes. I do Thunderbolt, Vajrasana. I do frog pose, Mundukasana, I do rabbit pose, Shashankasana, I do Kapalbhati Pranayama, I do abdominal lock, I do Agnisar Kriya, I do the spinal twist to stimulate my pancreas. We do all this stuff, so we know it works. But again, if you keep on doing it, it's exactly like taking a pill from the Western medicine. And I see all the time, for back pain, do this, this, this. For knee pain, do this, this, this. To hip pain, do this. It's fine, beautiful. You'll take care of it. But you see, I have some knee problem, and I'll show it to you today why I have a knee problem. That is due to my body shape, due to my posture. Knee is transmitting your body weight to your heel. When the knee is not properly transmitting, when there is a deformity, call it the valgus deformity or this angelic deformity, you get the problem in the knee joint. Inflammation is one, arthritis, or you broke down the cartilage, called degenerative joint disease. You can do a chair pose, Utkarasana. You can do a Gururasana, eagle pose. You can sit down like a Sukhasana, Siddhasana, Padmasana. But on the other hand, if I can sit down in a cross-legged, I can sit down in a Utkarasana, I can sit down in a grounding poses, maybe the Vajrasana, I'm not going to have any knee joint problem or hip joint problem or a back problem. I need to prepare my body in stages so that it becomes part of my daily practice and it's a permanent cure at the root. Now let's talk about a couple of minutes what you're talking about the art, and then we'll do the practice. The first, if you look at, say, a Western medical practice. Western medical practice is based on an acronym called S.O.A.P. 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 will be, S is subjective. Patient comes to a physician and says, I have this complaint. Physician listens to it. Based on that, does an objective. Objective is physical exam, examining the patient from head to toe, ordering tests, ordering imaging. And when all the informations are there, then comes the third stage called assessment. Subjective, objective assessment. Now I'm assessing what is the situation with this client or a patient, and finally P is the plan. So make a plan. Make a plan for what is the next step. What the therapy I'm going to prescribe, what are the daily routine I'm going to prescribe, what is the lifestyle I'm going to prescribe. But yoga therapy thinks about little beyond science, that is called art. So in a Western medicine, we learned our body, called anatomy, by dissecting a dead body. This body has a life, which is called prana. Prana is a subtle energy which is carried by your breath. So breath is our physiology. Breath is our life. God created us from this dust or clay, whatever God created us, then gave us the breath to be alive. So physiology is a breath. Physiology gets abnormal, call it pathology, and we treat the pathology. But in yoga therapy, beyond physiology, this body has a mind called Manomaya Kosha, 5 layers. Physical body is called Annamaya Kosh, is a food layer. Physiology is called Pranayama kosha. It's a breath layer. Third layer is the mind, Manomaya kosha. Mind is the content of your five senses. So yoga therapy says you have to learn how to control your mind. Mind gets controlled through your breath. Remember, breath is conscious and subconscious. I'm sleeping, I'm breathing. That is the function of my brain stem, autonomic function. I'm sitting here, I can breathe out, take a deep breath in. This is a function of my cerebral cortex, conscious. Breath is the connector between your brain stem and cerebral cortex. So the mind will control our five senses, which is called pratyahara, through our Brahmari Pranayama, bumblebee breathing. And during breathing, we breathe out negative emotion, breathe in positive emotion. I'll talk about it. What are the negative emotions? Yoga gave it to us. They are called the 6 ripus or 6 enemies. I'll talk about it a little later. Kam, Krodh, Lobh, Moho, Madh, Matsarja. 5 sufferings called kleshas. Avidya, Ashmita, Rag, Viddesh, Abhinivesh. I'll come back a little later. This mind has a intellect. This is a wide, pervasive layer, intellect. That is called buddhi. All the information which comes to our mind, when get properly processed, it becomes an intellect called buddhi in Sanskrit. Intellect comes from reading a scripture and looking inside yourself, called self. Beyond the intellect is called your bliss, blissful koshas. So intellect is called the Vijnanamaya kosha, intellect. And finally is called the Anandamaya kosha, or your blissful state. So intellect and the bliss comes to get balanced or get literally cured with a introspection, looking inside yourself. So how do you look? It's called self-discipline. Self-discipline in yoga is called a dharma. Dharma is the law of the nature which keeps a microcosm in balance with macrocosm to be healthy and not to have any dis-ease. Law of the nature which keeps a microcosm in balance with a macrocosm. Self-discovery. Self, remember, looking inside yourself, self-discovery, introspection. I have diabetes. By self-introspection, I find out, yes, I am the cause and I am the cure. Why? I go to see my doctor, checks my blood sugar, checks my hemoglobin A1C, gives me some medication for my blood sugar. But if my blood sugar goes up today, I'm the only one who knows what I ate, who did I fight, who did I cuss, what was my mind, what was my body. I'm the only one who knows. So I'm the cause and I'm the cure. Finally, self-realization. Self-realization is called enlightenment, knowing yourself. And self-realization means you got to develop a real eyes. The eyes are now turned backwards. You're looking inside yourself. Remember, a treatment of illness is a external, is a physician or a health provider centered. But the wellness which yoga therapy brings it to us is self-centered. My physician is telling me, yes, I am your guide, I am your coach, but you are going to take care of yourself. So now, for a yoga therapist, what they're looking at the level of your blissful state, we're in balance, we're absolutely healthy. When it comes down at the level of your intellect, imbalance starts, but my intellect pulls me back. Don't do it. I'm still healthy. At the level of my mind, all the imbalance starts. So the mind is the root cause of all of our endogenous disease. Endogenous disease are also called NCDs, non-communicable disease. By the time my mind is in imbalance, it shows up in my breath. My breath is erratic. Breath is not smooth. There is no long exhalation. And by the time it comes to your physical body, it's already too late from yoga perspective. If you look at other way around, suppose you take a patient who has asthma. I give an example, it is very easy to explain. In asthma in a physical body, the tubules which go into the lung, it constricts, so I cannot breathe, I get a shortness of breath. So in physical body, it shows up in your breath. Pranayama kosha. When I cannot breathe properly, I get very anxious, I get restless, affects my mind. When my mind is not in balance, when I'm restless, when I'm anxious, my intellect goes down. I don't know what I'm doing, and I do something very absolutely stupid. When my intellect not in balance, my bliss, anandamaya kosha, bliss goes away. So, when a client or a patient comes to yoga therapist looks at first the structure. Look at the structure of the body. I will show you and give you the little practices now, and which will incorporate in your practice. What are the structures we're looking at? First structure we look at the structure of the spine. If the spine is straight. Give an example. Person comes with a depression. You know what the depressed people do? They're sitting down, hunchback, head down like this. This is the physical posture. So if you're going to treat a patient with depression, you're going to correct the physical posture. Okay. What is the structure? When you look at the different aspect of it, look at the pelvis, if the pelvis is centered. Even here, if the imbalance, I'm sitting down in a Sukhasana, easy pose, see if I can change my foot and sit again comfortably. You see, balancing both sides of my brain. So in a structure, you look at first body shape. What is the shape of the body? Is the body straight? If the pelvis is aligned with your spine. Look at your hip joint, look at your knee joint. You look at if the weight transmission in the hip joint and knee joint is proper. If the knee joint has a little bend, one is called a valgus deformity, one is called a varus deformity. You will see people, especially when they come to me, it's not straight. The knee joint comes down and there is a little bend in the knee joint. To look into it. Look at the shoulder, look at the neck. Look at if the shoulder is in the same length. Many people you see, they have a problem with this cervical area. They have one neck is a little higher up than the other. You look at a clavicle. Clavicle is not properly centered. So for the structure, you look at the shape. And I'll tell you about that. Yogic BMI, or body mass index. Shape. Then the flexibility. Flexibility of the spine is the structural solution for yoga therapy. Flexibility of spine. Then comes the balance. If you do a balance in both sides of your brain, we are not balanced, we are lateralized. I'm right-handed, right-footed. I'm always using my right hand and right foot. Can I use my left hand? Can I brush with my left hand? Can I pick up something? Can I write with my left hand if I'm a right-handed? Can I stand on my one foot? Can I stand on one foot with the eyes closed? Balance. I'll show you the balancing poses. Then comes your strength. Shape, flexibility, balance, and strength. Strength is your strength on your hand. You can do a Tolasana. You can do a Bakasana. You can do a Mayurasana, Mayuriasana. That is your strength. You build a strength. You build a strength by using your larger muscles. So looking at the structure. Next you look at the breath. What is the person sitting in front of me, what the breath looks like? When the breath is rapid and shallow breath, that means they're in a sympathetic overdrive. They're in a very high stress. The limbic system of the brain is active. Limbic system, hypothalamus, pituitary axis, called psychoneuroendocrinology. And no, this is a patient and this is not a functional disease. Then during interview, I ask him or her the proper sign of health. In yogic tradition, proper sign of the health is strong digestion, easy elimination, and good night's sleep. Yoga gave us 5 asanas, 5 or 6 asanas for strong digestion, igniting our digestive fire, or Jathar Agni. Gave us 5 asanas for proper elimination. And there are 2-3 asanas for proper sleep. So ask the person, how is your digestion? What is digestion? When the food is properly digested, part of our body, we see few signs. Lightness in our body and mind. I asked them, after you eat food, do you feel heavy? He said, yes. From yogic perspective, he or she is not well. Excreta smells, your stool smells, urine smells, perspiration smells. The food was not properly digested. Appropriate natural urges. No smell in your belch. Same way, proper elimination. Wake up in the morning, I sit down in the malasana, I drink a glass of water, which I've shown you many a times. You have a gastrocolic reflex. You have a proper peristalsis. First thing in the morning, you have a bowel movement. Proper elimination. Good night's sleep. Go to sleep by 10 o'clock. Sleep has a or REM sleep, non-REM sleep. Non-REM sleep is stage 1, stage 2, stage 3, stage 4. Stage 1 and stage 2 got 50% of the sleep, but stage 3 and stage 4 is a deep sleep. We always look for non-REM deep sleep. It's not how long you slept, 6 hours, 8 hours, 4 hours. It's how long you had your stage 3 and stage 4 sleep. And most of the sleep apps these days, they figure it out. We look at the mind. Very easily you can see the mind. You know, how is the response to the 5 senses? How they react. You know, when your mind and brain doesn't function properly, that you do not execute your input senses. It's very obvious in a special child. When you see a special child with a autistic kids or even adult with autistic people, they have a proper input. But the mind is not properly processing, so output is not appropriate. Intellect, we see their self. And also what we look at from a yogic perspective is called Ayurvedic yoga therapy. Look from Ayurvedic standpoint, what your body type, or your vata, or a pitta, or a kapha, and there is a diseases. Vata is called ectomorphic. It arises from the ectoderm. So you have the disease of the ectoderm, neuropsychiatric disorder, musculoskeletal disorders. Pitta is a mesoderm, mesomorphic. They get inflammation of the organs of the mesoderm. Inflammatory disease of the heart, disease of the liver, disease of the intestine. Kapha, endomorphic from endoderm. They develop disease of the endoderm. Fluid-related disorder, tumor disorder. So let's go ahead and start practicing. We talked about for a long time. The first practice will be structure. What is structure? First we say is a shape. Proper yogic shape. Let me show you. You know what is called BMI? BMI is called a body mass index. Body mass index is the one which we as a Western trained physician use. It is the weight in kilogram and height in meter square divided by, and the number, a good number is between 18 to 25 BMI. BMI above 25, you're getting into little obesity. Above 30, you're obese. And beyond 30, 35, you're morbidly obese. In yoga, body mass index, first you look at your wrist. Look at how beautiful it is. You know, I just want yoga teachers to take a look at it. You take the hand, you measure the wrist, see where it comes. Do you see my finger? See where is my thumb and my middle finger. This is my wrist. So it overlaps here. You bring the hand in the middle of your arm. The separation between your middle finger and the thumb will be little more than what was the distance here in my wrist. Here it is, just to be clear, here it is. This is the overlap. From here is the overlap. So I'm going to have a little bit more than this as a separation. So here I am. You can see my arm, see my fingers. So my separation is more. Yogic BMI. Next yogic BMI is that if you look at your thigh, middle of your thigh, if you put your hand here and your thumb here, between your thumb, between the two hands, you should be able to put it together. In the middle of your thigh. Yogic BMI. Can you see it? Sitting down is better, but again, I'm going to show it to the middle of your thigh. You should be able to put it together. Comes your abdomen. You have to put your hand on this side. Bring your finger slowly. At the level of belly button, you'll be able to touch your middle finger. This is the shape of your body. Remember, once you have this, you are disease free. I'm not interested about the disease you have. I'm interested about your whole being. How to cure all of your non-communicable diseases from the root. Wrist, arm, middle of the thigh and the abdomen. Okay. Shape. Flexibility. First flexibility is you do the little bit of a relaxation of your upper part of the body. How do you do it? We've done it all the time. Your hand, you do Adhimudra. Thumb inside and close. Say, I am sticking to the same practice you do, so you don't have to change your daily practice. Shoulder, you can do the breathing. Breathe in, slowly rotate your shoulder. Bring flexibility. Remember, most important flexibility is the flexibility of your spine. Do the opposite side. So how to bring? First, make the spine straight. So upper part of the body, you make it straight with a prayer pose to the back. Paschim Namaskar. Take the hand here, slowly and slowly do the prayer pose, and do the prayer pose to the back. Keep your spine straight, and in the breathing, you always remember to breathe out longer than breathe it in. Breathe out first, count of 2 in, count of 4 out. Count of 4 in, count of 8 out. Do the count of 4 in, count of 8 out. My hand goes back again in a prayer pose to the back. Count of 6 in, count of 12 out. Remember, you do it completely effortlessly. We've been doing it for so long, we can easily do it without any effort. So I'm breathing out first. Count of 6 in, count of 12 out. Count of 8 in, count of 16 out. If you keep doing this thing, in a short time, your spine will be straight. People like us in our age group, we develop a little hunchback. Then relax your neck. Remember the shoulder, one side is up, always one side is tight, and do it a Brahmari Pranayama. You have done it so many times, I've shown it to you. Just to show you one more time, put your head to the back, breathe in, and breathe out with the sound of a bumblebee. I find with your experience is that when you're able to relax in the upper part of the body, able to relax your neck, your back pain goes away, your hip pain goes away, knee pain goes away, because the chronic pain is due to the tightness. So 4 postures in the neck, side to side, looking at the back, and then rotate. If you're doing with me, let's do it. This is a very wonderful practice. Prayer pose to the back, my hand is in a prayer pose. I have a profound level of relaxation. I have a saliva in my mouth. That means sort of parasympathetic activation. Breathe out first. Take a deep breath in. Look all the way to the back. Finally, rotate your head, putting the head down. Breathe out first. Take a deep breath in. Practice you always do of relaxation, pumping and cupping. Rub your hands. When you feel the warmth in your hand, you feel wearing your glasses, remove your glasses, take the hand as a cup, put it over your eyes, let the eyes take all the heat from your hand, massage your forehead, massage your eyes, massage your face, massage your back of your ear, front of your ear, the tragus, the one here, inside your ear. This is called the auricular branch of the vagus nerve. Come here in the neck, massage the carotid sinuses. Carotid sinuses are calming, cooling, parasympathetic activation. You will see your body gets almost like a fluid and body relaxes. We, at this time of our life, we suffer from multiple disease. I have a knee pain. For me, I have a knee pain. I have a hip pain. I have a back pain. My wrist hurts. Then I have a heart disease. I may have a diabetes. I may have multiple. So how many asanas, how many practices I'm going to do as a reductionist approach? I might keep them in my toolbox, but I have to do a daily practice. And this is the daily practice. Shape, flexibility. One very flexibility is, flexibility of a spine. So the flexibility of a spine in the morning, also what you can do, you can see if you're able to sit down in a squatting pose, malasana. I do it every morning. Here my ankle is relaxed, my knee is relaxed, my hip is relaxed, my hand, I separate my hands, separate my wrist, Put my one elbow inside, other elbow inside. Slowly I bring it close to me. Eyes closed. It's a profound relaxation of the whole body and mind. Incorporating this in your daily practice is yoga therapy. If you're able to do it, your knee pain will go away. Your hip pain will go away. Your back pain will go away. I'm not going to do the things for my knee pain. I have a right knee pain, little swollen right knee, but I'm overcoming it. From here, if you can get up without a support, it's a wonderful practice. For spinal flexibility, in sitting down you can do other asanas like you can do yoga mudra, like sitting in a cross-legged, or in sitting in a chair, you do a forward bend and touch. So you need to do in a spine a lateral bending, like a side bending. You do a front and the back, but support it. I hear it all the time. I have a back pain. Okay? Don't do a front bend. Don't do a back bend. Yeah, don't do an unsupported back bend, unsupported forward bend if your body is not ready. If you're a yogi, remember a transformation from rogi to nirogi to yogi, from a patient to a healthy person to yogi. We are yogi, we can do back, front without any issue. But I'm showing it to you who are the diseased person. The first one, even in the standing position, you can do a Paschim Namaskar, you do a neck rotation. From there, first you do the asanas. Remember, these asanas are also called 3 asanas for Shankha Praksalan. Shankha Praksalan means easy elimination. There are 5 asanas for Shankha Praksalan. One sitting down, I'll show it to you, what is called a Shankhasana, or called a Udar Karshanasana. One laying down on the face down is called Tirjak Bhujanga Asana. It's called an oblique cobra pose. And standing is called this upward mountain pose, oblique mountain pose, and west rotation pose. These are also very functional for your spine. Also, you can do for your posture, if you want to train your posture, you can always go against the wall. Like you can go against the wall like this. If you can see me, I will put my heel there, slowly I put my body, my back of my head, and in exactly in the straight line as in the wall. Put my hands high up, close my eyes, and breathing out longer than breathing in. Keep on doing it. In a short time, the back pain will go away. I'm comfortable standing like this. Put your feet together. Spinal flexibility. Clasp your hand, put it over your head. Breathe out first. Take a deep breath in. Breathing out, slowly get your tippy toes and hand goes way higher. Upward mountain pose. Final flexibility and also for your proper elimination. Shankha Prakshala. Loghu Shankha Prakshala. Tirjak Tadasana, oblique mountain pose, hand goes high up. You breathe out first. Remember, do not hold your breath. Every asana will be relaxing like your Savasana, and your breath will be completely effortless. Breathe out first. Take a deep breath in. Slowly put your body on one side. Do not hold your breath, keep breathing. Breathing out longer than breathing in. And if you can come to a posture, you stay here, keep breathing as long as you can. Slowly come back high up. Breathe out first. Take a deep breath in. Slowly go to the opposite side. This is a daily practice. Daily practice to keep the flexibility. Flexibility of the spine is the health. The rigidity of the spine is the disease. Proper elimination is health. Proper digestion is health. Dreamless sleep is your health. West rotation pose called Kadhi Chakra Asana for spinal flexibility. Take your left hand to the back, right hand on your left shoulder. You breathe out first. Take a deep breath in. Slowly turn your body all the way to the back. And in the same breathing cycle, come back in the middle. Same thing in the opposite side. Right hand goes to the back. Left hand on the right shoulder. Breathe out first. Take a deep breath in. Turn your body all the way to the right side. Slowly come back in the middle. You can do the same thing with your hands in front. So keep your hands in front. Breathe out first. Take a deep breath in. Slowly rotate your body all the way to the back. And then slowly come back in the middle. It's a wonderful practice. It is so relaxing. This is called even moving meditation. Now do one thing for me if you're doing with me. Close your eyes. Close your eyes, follow your breath. Close your eyes, breathe out first. Take a deep breath in. Slowly turn your body all the way to the back with your eyes closed, but you can clearly see where your hand is going. All the way to the back. And slowly come back in that way. If you keep on doing it with your eyes closed, following your breath, you enter into a state of called moving meditation. Meditation is staying calm in the middle of crisis. Side bending is called lateral bending. Lateral bending improves your pulmonary function. Your lung function gets better with the lateral bending. And the back bending improves your ejection fraction of the heart, like the function of your heart. But when we are a rogi, people with disease, we like to do it slowly and slowly, like touching the back of our wall, like we do, which is called your Chakrasana, wheel pose, to hold your hand into the back. So the side, the wonderful asana is called your Trikonasana, triangle pose. It's a side bending, lateral bending. In fact, Trikonasana asana is so powerful asana because it does the flexibility of the spine. Also, it massages your abdominal part. And all the disease we have here is called your Udarkarshan, massaging your abdominal part. We used to say, one apple a day keep the doctors away. We said one Trikonasana, one triangle a day, keep the doctor's way. Separate your feet, comfortable width. Turn your right foot out. And again, remember, alignment will come to you. Do not look for alignment. Do not even, you know what is a perfect posture. It will come to you. So hands on both sides. Touch your right hand to the right knee. Let the left hand go higher, and I'll show it to you. I'm a diseased person. My hand is, it's okay. Stay here. If you can keep coming down, stay here. Keep your eyes closed if you can stay here. Why? This is your Savasana. So I'm not even raising my hand high up. I can, but I'm showing it to you that you can keep it like this, all the way high up, eyes closed, stay here between 5 to 10 breaths. This is a daily practice. Spinal flexibility. When you get up, put your hand on the waist, support your body. Don't let the body go high up. Supported bends. Very, very important concept. Other side, let your turn your left foot out. Same sequence, hand on both the sides. Left hand touching your knee. Right hand goes high up. Look into your right hand. Left hand keeps coming down. If it can come all the way down, hand goes in front. A lot of things you can do. You can do a revolving triangle called eyes closed, breathing in and out, 5 to 10 breaths, hand here, supporting your body, coming back. Supported back bend. Supported back bend, the best asanas are on a mat. You are on the mat, you face down, and you do cobra pose, bhujangasana, you do locust, shalabhasana, or you do your bow pose, dhanurasana. Those are supported back bend in a mat. Very important concept. In fact, supported back bend in a mat is a treatment for your back pain. So if you get a herniated disc, we call a slip disc, if the two vertebrae and the disc has protruded in front. So if you're able to bend it back, you make it in space, you're able to suck it in. Supported back bend is your therapy for chronic low back pain. Suppose if you want to do a back bend, you cannot see me here. You cannot see me here. You can see me probably here. You know, if you get a wall, or maybe you get a wall here, it's too far. Anyway, if you get into a wall, suppose I have a wall here, I get into a little bit on the front, supported back bend. I slowly go to the back, put my hand down, even may support my head, go all the way down, and then I push myself in the front. My eyes are closed, I'm breathing effortlessly, I'm breathing out longer than breathing in. See how slowly I went there, and slowly I supported myself. Supported back bend. Same thing is for your supported forward bend. What is a supported forward bend? If you are doing a supported forward bend, you can do called Prasharita Uttanasana, or if you get a little back pain, what you can do, maybe you can see me here, okay? So what we'll do, you will first, when you bend, forward bend, you can keep a feet together or feet can be separated, either way. I like to keep my feet together because with the together feet initially it helps because it takes you down to your Padmasana, hand touch your feet. Put my hand here, support myself, and slowly I come down. But I keep my spine straight. Remember, this is very important for your yoga therapy practices. Asana is a very important practice. Prepares your body with a relaxation response, then you enter into pranayama and the meditation. Slowly is coming down. Or if your back needs to be supported, look at how beautiful it is. You can see me. Okay. Here I have a counter here. I will go ahead, put my head in the countertop, let my hand hang loose, close my eyes, I breathe out longer than breathing in. Supported forward bend. It is a powerful tool during your acute back pain. If you get a sudden acute back pain, or you can go a little lower. So this is the side of my sofa. Okay. So you can do again, put your hand supported, slowly put your head down, but hang loose, very loose. I can put my hands here, close your eyes, breathe out longer than breathing in. If you're practicing with me, try this. You will find a profound level of relaxation and you're not going to hurt yourself. So remember this, I have a back pain, don't do this, don't do that. Don't do anything. There is no contraindication in yoga therapy practice. Only contraindication is your mind. You listen to your own body and progress. See, I was way high up there, came down here, now I'm going down to here. There it is, little bit of less, I can do it again. Slowly come down, here comes my head, all the way down, supported forward bend. In stages, impossible become possible. So what will happen next? I came from there, there, there. You saw me doing the back bend. You did this lateral bend. So I'm here. Slowly I'm coming down. My hand is on the ground. My hand is on the side. And slowly my head will come. And my head will touch the knee. You put my hand in the back, my eyes are closed. Padmasana. Another wonderful daily practice, which I do every single day. very important for the men and women. You will see when I do my head down, this is called widespread forward bend, Prasarita Uttanasana, and you're so relaxed, you can do a Kapalbhati Pranayama. Do Kapalbhati Pranayama, you massage your pelvic floor. So men with a prostate disease, prostate problem, women with a pelvic floor dysfunction, it is a wonderful practice. So keep separating your feet. Keep separating more. The hands here, slowly hand will come down. All the way down. So you can separate all the way up to the width of the mat. Put the head down. And you do a Kapalbhati Pranayama. You can feed your pelvic floor. You can feed your pelvic floor. You're getting a massage in the pelvic floor. You're getting a massage in the pelvic floor. You're massaging your prostate gland, which is one of the very important conditions for men. Also, it massages the pelvic floor, and most of the pelvic floor dysfunction is for the women because of the childbirth, because of the bladder problem. So pelvic floor dysfunction gets corrected with Prasarita Uttanasana with a Kapalbhati Pranayama. So we came to the shape, came to the flexibility, we came to the balance. Most important balance you will see when you first create, when you cannot do it, any balancing poses. We sit down in a chair, sit down in the ground, we do alternate nostril breathing. Alternate nostril breathing, activate both sides of the brain, left nostril activate right side, right nostril activate left side. Right brain is coming, cooling, parasympathetic, called Chandranari, moon energy. Left brain is analytical, hitting, sympathetic. Right nostril is called your Suranari, sun energy. Then what you do, going against the grain of your habit is balance. Remember, three remember, especially for yoga therapy teachers. Going against the grain of your habit is balance. I'm right-handed, I'm always putting my right foot in the front when I'm walking. Consciously you will do now, put the left foot up front for walking. Getting up into the steps, you will see the same thing will happen. Now get up into the steps and we'll start putting the right foot first. Getting up in the step. Then you always see I'm putting my right foot all the time because I'm right-footed. Put your left foot first, then you put your right foot. Put your left foot, then right foot. Left foot, right foot. Coming down in the steps. Left foot first, then the right foot. Left foot, right foot. Brush your teeth with the right hand, try brushing your teeth with the left hand. If you hold your fork and spoon with your right hand, use your left hand. Comfortable, standing like this, separating your feet, put your feet together. Going against the grain of your habit is your balance. So now you're going to balance in one of your feet. Most of the balance also has your hand. Remember when I fell down, I put my hand. In fact, when you fell down, you put your hand, outstretched hand, there's a fracture called a Colles fracture, very common fracture. Then is your Vishuddha. So take out your hand. You can do a prayer pose to the back, Paschim Namaskar, or you can do a Baddha Hasta Asana. Right hand, hold your left arm, left hand, hold your right arm. I'm right-handed, right-footed, see if I can stand on my left foot. 10 seconds, 20 seconds, 40 seconds, a minute. Then one of the most impossible tasks you do initially, close your eyes if you can do it. If you can close your eyes and stand on one foot, you have literally brought the balance back in your body, mind and spirit. Closing your eyes, standing on one foot. Initially it will be very difficult for most of us. Hold into a chair. If you have a chair, just get into a chair. So keep a chair next to you. You're doing. Just when you put your hand on a chair, close your eyes, do it, and see if you can slowly take the hands off. Again, balance it in the opposite. Now I started with that right hand holding the left arm, left hand holding the right arm. Go over in the top, left hand holding, right hand holding the left arm. This time I'll be standing on my right foot. Standing on my right foot. Very count. I keep on counting. In my practice, and I do a little bit of a poem. I'm in a Bengali poem, or I do some mantras. Close my eyes if I can stay here. Quiet down my mind. You'll see your one side will always feel better than the other side. So what you need to do, you'll be doing more balancing the what is opposite side which you are not being properly balanced. Same way, if you have a chair, do right with the chair. Hold your hand, close your eyes, and slowly take your hands off. You'll be wobbly initially. Touch it again. Hold it. Very important concept. Another thing you will notice that many of you do very nice, say, Vrikasana, tree pose. You can take your one foot, get into a tree pose. Then you will notice one thing. In a tree pose, you put your hands in front, or hands way high up. Very nice. Now you take the hands, put it a prayer pose to the back. Tree pose with a prayer pose to the back. A Vrikasana with Paschim Namaskar. You'll see a little different, you feel a little different than your regular tree pose. You always do the other side. Very, very important. Shape, flexibility, balance. What is the shape? Remember, rest, you hold, the separation you have, you will have a same distance in middle of arm. Hands in the middle of your thigh, and abdomen touching your bottom. You don't need to do, by the time you do this, you are not doing anything to, I have some asanas, pranayamas to quit smoking, quit drinking. Everything will go away slowly and slowly. Sitting down, asana. This is called your Udarkarshanasana or Shankhasana. It is one of the asanas for your easy elimination. There are 5 asanas for easy elimination. is called Shankha Prakshalan. In a regular Shankha Prakshalan, what you do, you drink 2 glasses of water with a little salt in it, and you do this 5 asanas. Nothing happens. Drink again 2 glasses of water, do 5 asanas. Again 2 glasses of water, 5 asanas. Within half an hour to 45 minutes, you start having a bowel movement. Slowly and slowly keep on doing it. Essentially you see just the water comes out. And you get the absolute cleaning of your whole gastrointestinal system. You do it once. This is a part of called your Kriya. Kriya is called your cleansing of physical body. Generally we do, this is called Purna. Purna means full. Shankha Prakshalan, about every 6 months you can do it, cleansing your body. But we do it called a Laghu. Laghu Shankha Prakshalan. Laghu means your little early. Put your hand on both the knees. Take your right knee in front of your left foot. Comfortably. Don't push. Don't do anything. Left knee comes towards your right side. Take a deep breath in. Slowly turn your body away from you. Shankha-asana. 4th asana of your proper elimination. Upward mountain pose, Utthita Tadasana. Oblique mountain pose, Tirjak Tadasana. West rotation pose, Kadhi Chakra Asana. This one, Shankhasana. Then we'll do another special cobra pose. It's called Tirjak Bhujangasana. Now, take it the same way. Take your left knee in front of your right foot. Right knee comes towards your left side. The hand, take a deep breath in, slowly turn your body on the right side and able to breathe. And slowly come back into your Malasana. Okay. Let's go ahead, do a few asanas on the mat. Then we'll do some hand strengthening poses. Get totally embedded in your body and mind. Shape, flexibility, balance, strength. Proper digestion, easy elimination, good night's sleep. Don't need anything else. Pranayama, powerful pranayama, breathing out longer than breathing in. Breathing in positive emotions, breathing out negative emotions. Okay. The first one, the 5th asana for your proper elimination, Shankha Prakshalan, is your Tirjak Bhujangasana, oblique cobra pose. So normally you do a cobra pose, you put your face down, you have your face down, keep your feet together, hands on both sides, you slowly get up into a cobra pose. But here what you will do, you will separate your both the feet up to the width of the mat, slowly get up into a cobra pose, then over your right shoulder, You look into your, over the left shoulder, you look into your right foot. Then you come down again. Then you get up into the, again, cobra pose, or right shoulder, look into your left. For the back pain, supported back bend, you will do a cobra pose with your locust, raising your both the feet high up, and a Dhanurasana. You can put your feet here, get up into a bow pose, slowly get into Dhanurasana, and relax. One of the powerful relaxing asana, this is called like a Savasana with the face down. It's called your Shakti Asana, strength. Like put your hand down, slowly bring your hip at a right angle, knee at a right angle, face turn to the same side, and you relax. Do the same thing, look in the right side. Yeah. And slowly turn around. You lay down on your back and do the asanas for your digestive fire. And then we'll do a couple of asanas to improve your sleep. Okay, so now you slowly turn. Remember, when you're turning, when you're laying down, you go very gently, you get in and out. You don't get suddenly in one way, suddenly in the other way. So here is your feet. Head comes down. Generally, you like your chin a little bit tucked in. You don't want the chin too high up. It's very sympathetic. Chin tucked in and head on the ground. If you cannot do that, you can put a little pillow and do like this. Separate your feet up to the width of the mat, hands on both sides, palm facing high up. First you do the abdominal breathing. Abdominal breathing brings a relaxation response called parasympathetic activation. You're like a baby. Like when you're breathing in, hand will go high up. Breathe out, hand will go in. Breathe in, breathe out. It's a wonderful practice. Then do your breathing out longer than breathing in. Then you're doing, remember, all the asanas geared towards your belly button. Belly button centering is a sign of your health. One way to do it, you can put a little thread from belly button to your nipple line. All will be equal. For female, you can do a belly button to your end of your clavicle, the collarbone. Also another way is when you push your belly button all the way to the back, you'll be able to feel a pulsation. It is called an aortic pulsation. That tells you your belly button is in the center. If your belly button is not in the center, your digestive fire is not being properly ignited. So the first asana you do, put your hand, feet together, is called feet raising, Padmasana. From here, you come back a little bit, you can get into call your Nokasana, both pose. Get your feet, yep, body height up, Nokasana. From Nokasana, you do Pavanmuktasana, to bring your knees all the way close to you, your nose touches your knee, chin comes in front, you do it side to side. Wonderful practice. You do Markadasana, spinal twist. You can do a little interesting way, raising both the feet high up, look into your left hand and put both the feet touching your right hand and look into your left hand. Then slowly come back up. Do the same thing on the opposite side and look into your right hand. Bridge pose. You can put your, touch the back of your heel, slowly get body high up, hands scared. When you stabilize, you can get 1 foot high up, drop it down, other foot high up, drop it down, slowly come down. Wonderful practice. The final asana to ignite your Agni is your Padmasana. Take your 1 foot, slowly bring it up, touch your foot to your forehead. Take the other foot also, slowly bring it up. So, feet raising pose, butt pose, knee chest, Markadasana spinal twist, bridge pose, feet touching your head, Padmasana. 5 or 6 asanas to ignite your digestive fire. For sleep, initially sleep like a baby. How the baby sleeps, they put the feet together, hands on both sides, close their eyes, and if you say baby, baby's hand will be like this, thumb inside and close. This is called Balu Mushti Mudra, baby fist. Put it on the side. doing breathing out longer than breathing in. Count of 4 in, count of 8 out. Count of 5 in, count of 10 out, very comfortably, as long as you don't have any effort. Then slowly you build the breath holding. It's a count of 4 in, count of 16 hold, count of 8 out. And if you can do it very slowly and slowly, you can do count of 5 in, count of 20 hold, count of 10 out. Just to count of 4, generally we do it about 4 or 5 times, puts you to sleep. Count of first, breathe out first. Count of 4 in. Count of 16 hold. Count of 8 out. About 5 times, you literally fall asleep. This is the way, if you see the baby will always sleep like this. That's why hip joint gets relaxed, site of emotion, knee joint gets relaxed, site of fear. Then slowly you turn into your right side, and yogis generally put a hand underneath the head with a folded hand. But if you need, just put a pillow there. In a fetal position. That's the way babies were there inside the mother's womb. Left nostril is open, which is a cooling. Body has a heating initially. It balances the heat. Sleep produces a cooling inside your body, and then muscle relaxation. After a short time, then you turn onto your left side and sleep on your left side. In the left side, your right nostril opens up. The warmth balances the coolness of your body, and then slowly you get up and straighten up your leg. Put your one hand, slowly get up. You can do a lot of other things and laying down. For sleep, you can do a called Viparit Karani. Viparit Karani is another wonderful, wonderful tool. This is your good dreamless sleep. Proper digestion, 5 or 6 asanas, proper elimination, and dreamless sleep. So we have shown you the shape, shown you the spinal flexibility, shown you the balance, strength. Here I am, I'm sitting very comfortably. I put one foot high up. This is called your Ardha Padmasana, and I'm a little relaxed. From a Padmasana, you put your other foot high up, you get into a Padmasana. Call it lotus pose. You're breathing in and out. This is so relaxing. Your breathing gets effortless. Always remember, breathing out first and breathing out longer than breathing in. Breathing out is your parasympathetic, breathing in is sympathetic. Count of 2 in, count of 4 out. Count of 4 in, count of 8 out. I've shown you how to easily do it. Strength is called Tulasana. Put your hands on both sides. Put your hand, push it down, your whole body will go high up. Body will go high up and stay high. Tulasana. Feel the strength and balance in your hand and the body. And the same with your lotus pose. You can do a Mayurasana and a lotus pose. That is called a Baddha Mayurasana, or we also call it Mayuriyasana. It's called a female version of the Mayurasana. That's called a Pongo Mayurasana. Pongo Mayurasana is Mayurasana with one hand. It's coming. Christmas is coming. Everything is coming. So here you're in a lotus pose. You slowly come down. Put your hand like a peacock, Mayurasana, hands in front, body goes high up. Your whole body goes high up and stays high up. Peacock pose on a lotus pose. A lot of other strengths you can show, you can do a lot of strengthening asanas. In fact, most of the asanas involving a larger muscle mass, like spinal twist, Bakrasana, or your Lord of the Fish pose, Ardha Asana. For your mind, always remember, it's a daily practice. You sit down comfortably. If you can sit down in a chair is good, sitting in a ground is good, sit down in a called easy pose, perfect pose, or a lotus pose. Hands in this mudra is called Dhyana mudra or Jnana mudra. You'll be breathing out, your body is very relaxed, very comfortable. You can breathe out longer than breathing in. Then, in your daily practice, you'll be breathing out all the negative emotions and breathing in positive emotions. That is the way control your mind. Control your mind also with a bumblebee breathing and also kind of Murcha Pranayama. We did a whole Pranayama session. We'll do Pranayama session, you will see it. We'll finish with called Chakra Awakening Meditation. Let's see what are our positive emotions, what are negative emotions, what yoga has said. I'm breathing out first. I'm breathing in with my positive emotions. What are the positive emotions I'm breathing in? I'm breathing in love. I'm breathing in joy. I'm breathing in pride. I'm breathing in gratitude. I'm breathing in forgiveness. I'm breathing in supportive, love, joy, pride, gratitude. Those I'm inhaling. What I'm exhaling, yoga said, 6 enemies of our mind. First, in Sanskrit, is called calm. It's called a lust. I'm breathing out my lust. Krodh, is anger, breathing out my anger within me. Lobh is a greed. I'm breathing out greed from me. Moho. Moho is a delusion, breathing out delusion from me. Mad. Mad is a pride. The pride within me, I'm breathing out. Matsarja or hingsha is called an envy. I'm breathing out my envy. So I'm breathing out my lust, my anger, my greed, my delusion, my pride, and my envy. These are all 6 enemies of my mind. Also, yoga gave us 5 kleshas, called 5 sufferings. I'm breathing out my 5 kleshas. First is avidya. Avidya is ignorance. Ashmita is the ego. Rag is attachment. Biddesh is a hatred. Abhinivesh, fear of death, clinging to the life. What I'm breathing out, the 5 sufferings, what yoga gave us. Ignorance, ego, attachment, hatred, fear of death. By the time you practice this daily, inhale positive emotion, exhale negative emotions, and yoga gave us this. Sharo ripu, 6 ripus, and 5 kleshas. Finally is the concept of the chakras to balance your body, mind and spirit and completely cure all the disease from your body. When the yogis close their eyes, they have seen some light in front of them. In the nature, they saw the light. The light they saw is the light of your rainbows. They connected the lights along the spine, and the spine where there is 2 channels. One is called Ida, called Pingala. Where they crisscross, they call them chakras, or the wheels. And these wheels have a potential spiritual energy. And the energy rises from the root of the spine up to the crown of your head. They assign the color violet, indigo, blue, green, yellow, orange, red. Violet at the crown, red at the root of the spine. They connected the organs, they connected the endocrine glands, they connected the nervous plexuses, and they connected the elements of our body, mind and spirit. Our body is made of 5 elements, like our universe. Universe is made of 5 elements, which is called space, air, fire, water, earth. And we'll see. We'll have the balancing asanas, pranayamas, mudras, bandhas, and the mantras. So go one by one. First, root chakra. At the root, which is red in color and has 4 petals. Muladhara Chakra. It's connected with your musculoskeletal system. It's connected with your sacral plexus, connected to your adrenal gland, endocrine gland, and is connected to your earth element of your body. Between the belly button and the root of the spine is your pelvic chakra, called Svadhisthana Chakra, connected to reproductive system of the body. It's orange in color. It has 6 petals, but they're not in balance. Reproductive system is the pelvic plexus of the nerves, ovaries and testicle as an endocrine gland, element of your body. Coming in the belly button is called your solar plexus chakra, called Manipur Chakra. Yellow in color, has the 10 petals, are connected to gastrointestinal system. This is called a therapeutic meditation. Like if you have symptoms of the gastrointestinal disease, you meditate on this chakra. Yellow in color, 10 petals, and it is connected to gastrointestinal system. Solar plexus of the nervous system, endocrine gland of the pancreas, and the fire element of your body. Come to the level of the heart, or the heart chakra. Anahata chakra, color is green. 12 petals, connected to cardiovascular system. Nerve is the cardiac plexus. Endocrine gland is the thymus gland, and it is the air element of our body. At the throat level, Vishuddha chakra, throat chakra, blue in color, 16 petals, connected to your respiratory system. Function is the communication. Connected to your pharyngeal and laryngeal plexus of the vagus nerve, connected to your thyroid and parathyroid gland, and connected to the space element of our body. In between the eyebrows and the third eye is your 6th chakra, called Agga chakra. Color is indigo, have 2 petals, connected to your endocrine system, connected to your pituitary gland, connected to your parasympathetic nervous system, and connected to your mind. This 5 was your body, 5 element, this is your mind. At the crown, the color is your violet, 1000 petal, connected through your nervous system. Function is the bliss. Connected through your cortex of your brain, connected to the pineal gland, and connected to your spirit. They are all in imbalance, and they get balanced with the asana, pranayama, mudras, bandhas, and mantras. So we'll do the mantras, and let me just give you the names so you will understand. The root chakra, the asana, is a grounding asanas, like here. Padmasana, like in lotus pose, your thunderbolt pose. Pranayama is a Kapalbhati pranayama. Mudra, it is a earth element, so it's a earth element mudra, called Prithvi mudra. And bandhas are called your root lock, Mulabandh. Sound will be your lam to balance it. Second chakra Pelvic Chakra. Asana is like your squatting pose, Malasana, or your like warrior pose, Birabhadrasana. Pranayama is a Kapalbhati Pranayama. Mudra is a water element, so it's called a Varun Mudra, touching your little finger and thumb. And bandhas will be a root lock, Mula Bandha. Sound will be Vam. At the third chakra, the asanas will be your spinal rotation, like massaging the hair, Bakrasana, or a spinal twist. All of the asanas we did laying down, those asanas, improving your digestive fire. Pranayama here will be your called Bajja Pranayama. You suck your stomach in and move your abdomen, called Agni Sarkriya. Bandhas will be abdominal lock, Uddiyani Bandh. And the mantra here is Ram, Lam, Vam, Ram. Come to your heart chakra. The asanas will be chest opening poses, like a cobra pose, or your bridge pose, laying down. Pranayama will be alternate nostril breathing, Ululol Vilum Pranayama. Mudra, it is the air element, so it will be your Varun Mudra, index finger down. Bandhas will be your for the throat chakra, the asana will be your Brahma Mudra, rotation of your neck. Pranayama will be Ujjayi Pranayama. Mudras, the space element, mudras will be your touching your middle finger and thumb. Bandhas will be a Jalandhar Bandha, putting your chin down, touching your chin to the chest. And sound, here was a yam, this will be hum. At the sixth chakra, the Ardha chakra, your asana will be child's pose, Balasana, or your rabbit pose, Shashankasana. Pranayama will be Om Pranayama. You do the pranayama, breathe out, breathe in, and breathe out. Om Pranayama will be sixth chakra. Mudra will be your Jnana Mudra or a Dhyana Mudra. And your Bandha will be your chin lock, Jalandhar Bandha. And the sound is called Sham, S-H. For your crown chakra, the asana will be Shishasana, the headstand. Pranayama is called Pranabho Pranayam. Pranabho is you do A, U, Ma. You do A with your, it's called a Chin Mudra. U is called a Chinmay Mudra. And Ma is called your Adhi Mudra. Pranabho Pranayam. Mudras, you do your Dhyana Mudra or Jnana Mudra. And Bandhas, you do all the three Bandhas together, which is called a Great Lock or a Mahabandha. Let's do the mantras to finish. It's called Chakra Awakening Meditation. Touch your index finger and thumb, put it over your knees. Visualize at the root of your spine, red in color, 4 petals, connected to your musculoskeletal system, and the sound is a lump. So you breathe out first, breathe through your nose, and breathe out with the sound of lump. Bring your awareness between belly button and the root of the spine. Orange in color, 6 petal, connected to reproductive system. Sound is a VAM. Breathe out first. Deep breath in. VAM. Bring your awareness in the belly button. Manipur Chakra, solar plexus chakra, yellow in color, 10 petals, connected to gastrointestinal system. Sound is rum, or like a rubber. Breathe out first. Deep breath in. Ram. Bring your awareness to the heart chakra. Color is green. 12 petals connected to cardiovascular system. Sound here is yum. Breathe out first. Deep breath in. Yum. To the throat. Color is blue. 16 petals connected to respiratory system. Sound here is a hum. Breathe out first. Deep breath in. Hum. To the third eye, in between the eyebrows. Color is indigo. 2 petals connected to endocrine system. Sound is a sham, SH. So breathe out first. Okay, deep breath in. Sham. Crown chakra, 1000 petals, color is violet, connected to nervous system. Sound here is Om. In yoga, Om has 3 components: A, U, Ma, A, U, M. A comes from the lower part of the lung, U comes from the middle part of the lung, Ma comes from the upper part of the lung. So breathe out first. Take a deep breath in. Slowly bring your hands in front of you. Touch your little finger and thumb. Separate your ring finger, middle finger and index finger. Call it Padma Mudra, Lotus Mudra. Connects your body, mind and spirit. Bring it close to your heart. Heart is the site of your soul. This is your remover of your sorrow, remover of your ignorance, bringing the positive emotion, removing all the negative emotions. Yoga gives us wellness, physical, mental, spiritual wellness. Physical wellness gives us strength and stamina. Mental and spiritual wellness gives us healing. Slowly put your hand together, bow your hand. This is called Namaste. I honor the divinity within you. You are divine. And finish it with a palming and cupping. Slowly massage your hand. When you feel the warmth of your hand, if you're wearing glasses, remove your glasses. Put your hand over your eyes like a cup. Let the eyes take all the heat from your hand. Slowly massage your forehead. Massage your ears, behind your ears, in front of your ears, tragus, in the external ear canal. Bring it down in the face and massage your carotid sinus. This activation of parasympathetic tone. Massage your back. Slowly come back. It's a wonderful practice. So today we talked about the art and science of yoga therapy. So remember, the science, we have a question, we have an answer. That's a science. Art is more of a philosophy beyond science. When you have a question, then you have a question after question, that becomes a philosophy. So thank you for joining. We'll be joining again on the next Saturday. Next Saturday we'll talk about the yoga therapy for healthy aging, because we have seen yoga therapy gives us a quality of life. It is not quantity. I don't want to live X amount of years. I want to have a quality. So will be yoga therapy for healthy aging. Please come and join again next Saturday, same time, 9:30 a.m. Eastern Time.